The international campaign, the 16 Days of Activism for No Violence Against Women and Children, is once again being observed in South Africa. It kicked off yesterday. But can we be hopeful about change when women and children continue to be so unsafe in South Africa, despite various efforts, campaigns and rhetoric? To discuss, we're joined by research specialist on gender-based violence, Lisa Vetten. Lisa, thank you for being with us as always. Do you think the campaign over previous years has had any impact on gender-based violence? Let's start there.
Yeah, I think a campaign, you must have realistic and limited expectations about the 16 days. The 16 days exist to raise awareness, to open up the space for conversation, but in of themselves, they do not have the capacity to dramatically reduce violence. And that's because they can't get to the structural heart of things like, of all the factors that drive and maintain their violence. So I think we shouldn't expect too much from the 16 days. They're there to raise awareness, but we need far deeper, longer and more extended interventions if you want to truly bring down levels of violence against women.
But just staying on this, is it worth raising awareness, talking about the issue? Does it start there?
It does, but it worries me that the 16 days have now been in place globally for 30 years, and there's a point at which you need to move beyond raising awareness. I mean, if it hasn't yet occurred to somebody that killing another human being is wrong, then I don't think another 16 days campaign is going to change that. What we are not getting to, I think, are the core structural factors that drive and maintain and keep violence in place. So, for example, if we look at where South Africa is now, I think we'd have a much better effect over the long term if people took whatever money they were planning to spend on events and ceremonies and rather gave that to shelters and to other organizations addressing violence against women. Because if we look at what Treasury is going to be doing to the budget and how it's cutting government budgets across the country both now and as of next year, then we should be very deeply concerned. Because those services do actually have an effect on violence. They reduce the after effects and they can reduce repeat violence. And if we take them away, we aren't going to be having those positive effects anymore. So I think it would be much better now, given our situation, to put that money into services.
One of the issues over the years has been safe houses, like you say. Women need safe places to go. Where are we in terms of that? Do women feel like they have options? Do women feel like they're being heard when they seek help?
That's, I think, the other problem is that it's still very much a lottery ticket, whether or not you get good help. There are certainly police officers who know that in terms of the law, they're required to inform women that things like shelters exist. And some research has shown that officers do that and they do it very well. But equally, there have been officers in some provinces who've said, what is a shelter? They've never heard of such a thing before. And that's really alarming when you consider that the legislation has been in place for well over 25 years. So I think our big problem is that we haven't embedded our legislation, our policies on a system-wide level. They're still much too dependent on whether or not the police commissioner, for instance, at a station cares about domestic violence enough to train his or her staff and to make sure that they put good people in place to run those services. It's not something you can rely on automatically. It's still far too reliant upon individuals. And I mean, I think another, for me, great disappointment is the Department of Health. It has never come to the table in any kind of satisfactory way in terms of addressing domestic violence. We've had policies suggesting that it should since the early 2000s. But at this point, if you go to a hospital and you've been injured, a doctor is still very unlikely to ask who hurt you, even if this might be the third or fourth time they're seeing you in the space of 6 months for injuries. So I think the fact that we're still not putting women in touch with help when they're presenting with injuries is also really very concerning.
Yeah, and surely that could be part of the curriculum, and doctors and nurses could be trained pretty easily how to deal with things like that. Lisa, last question. We spoke about the crime stats earlier, and murder of women has come down slightly, rapes down very slightly. No victory there, but you put it in context and said something's going on since COVID. Just give us more details.
Certainly. Well, I think the high point of women's murders was in the 1990s. And since then, we've seen a steady downward trend, which has remained more or less constant. There hasn't been a dramatic decrease, but it's definitely halved from where it was in the 1990s. And we saw that sort of low point being hit in around, being reached in about 2017. Stayed more or less the same. But after COVID, that trend started to reverse. And for the first time since the late 1990s, the number of women being murdered crossed the 3,000 figure. We need to explain why that is. It might be going in tandem with the increases that we're seeing with men, which means that we need to look at the gendered effects of how violence has increased in South Africa. But we also need to look at why, if men's figures are showing a bit of a decrease, women's are not. And I think one of the key areas we need to be looking at are stranger murders, because those showed the most dramatic decrease. And in 2017, one could already see that they were starting on an increase again, whereas the figures of women being murdered by their male partners were staying more or less constant. So the question we have to ask is that where the increases are coming from? And we also need to, I think, look at provinces. Eastern Cape is showing some of the highest levels of homicide in the country. And if we look at the figures there, those increases for women, they are now being more likely to be murdered than strangers than they were by their intimate partners. So there are clearly shifts in patterns going on in the country, and they're not the same everywhere. And it's really urgent that we try to understand what it is that's going on. Because trying to prevent stranger murder is different to trying to prevent murders between people who are known to one another. And so this has implications for our attempts to try and reduce levels of violence towards women.
All right, well, hopefully we can, you can be telling me soon that researchers have got to the bottom of that. Thank you for giving us that update and your thoughts on the 16 days research specialist on gender-based violence, Lisa Vetten.